There are concerns about a new disease associated with COVID-19 which seems to be affecting children. It's called paediatric inflammatory multisystem syndrome, and its symptoms include inflammation in blood vessels and in some cases kidney and heart failure. Dr. Jeffrey Burns is the Chief of Critical Care Medicine at Boston Children's Hospital. He was so worried about the new syndrome that he organised an international Zoom conference with 1,800 doctors and specialists from across 6 continents to discuss it. He told me the inflammation being experienced by children may be driven by the antibodies which are fighting off the virus.
You could look at the peak of COVID-19 infection in the general population in Western Europe, and then when you overlay when did this multisystem inflammatory process start, it starts about 4 to 6 weeks after the peak viral infection in the population. But in the cases where these children have presented with this multisystem inflammatory syndrome and they've measured the antibodies, they found what we call IgG antibodies. And what that means is when you produce a response, an antibody response, it's called seroconversion. It needs to be studied and more research needs to be done. But most of the conversation in the medical community is this looks awfully similar to what we call a post-viral syndrome.
Should parents be concerned about their children when they thought, they weren't going to possibly suffer from this, and now we're hearing about this inflammatory disease? I mean, how rare is this disease?
And that's an excellent question, because if it's your child, it doesn't matter if it's rare. What I would say to parents is this. This multisystem inflammatory syndrome is not a subtle presentation. You can rest assured that you have all the tools you'll need to spot this. You know your child better than anyone, and it'll be clear that your child has a persistent fever, greater than 38 degrees Celsius, centigrade, for over a day. And that persistent fever will be accompanied by one of or more of the following: a rash, abdominal pain or discomfort, labored breathing, not having a good appetite. In some, it'll look like they have a bad influenza virus. So it won't be subtle, and it doesn't come on rapidly. The other thing I would say is that right now at the Morgan Stanley Children's Hospital in the middle of Manhattan, New York, it's the largest children's hospital in New York City. They have about 35 children admitted in the hospital with this syndrome, this multisystem inflammatory syndrome, but almost all of them are being treated on the ward, the floor. They're not being treated in the intensive care unit. So it's not at all similar to what we're hearing about how terribly sick adult patients are getting, but it is true that there are a few critically ill children from this in other hospitals in New York right now and in the city of Detroit in the States. And I don't doubt that there's likely 1 or 2 critically ill children in Western Europe, probably in an ICU on a ventilator right now from this syndrome. This by and large affects school-aged children and adolescents. So far, it doesn't appear to affect infants to that same extent. In terms of gender, so far more males have been reported as having this than females, but we're going to have to wait for more refined analysis. And it's unclear whether there's a genetic predisposition to this and whether certain racial groups, there's a suggestion that it might be so, but I'm hesitant to go any further because we're so early on. We don't know, but I can promise parents out there, we are looking as fast as we can to try to figure this out.